Hello and welcome to Eureka Moments. I'm Seema Kumar. According to the Journal of the American Medical Association, 17% of the youth in the United States experience a mental health disorder. The pandemic has exacerbated issues in a system that was already faltering. We started Eureka Moments to give you stories of hope from the scientists behind the headlines. Today, we'll hear from some of those working in the mental health arena. First up is my conversation with Dr. Vikram Patel, a psychiatrist and Harvard professor from the Department of Global Health and Population, who is best known for his work in child development and mental disabilities in low resource settings. So, first of all, Dr. Vikram Patel, thank you so much for joining us from Boston. It's great to see you again. The last time I saw you, you were in India, and we were at the height of the pandemic. So, the good news is that the pandemic somewhat seems to be getting under control, slowly but surely. But of course, it has exacerbated many mental health issues of the past 18 months. I mean, how are you seeing this manifest itself?
Well, I think the most important manifestation has been the concerns around young people's mental health. Quite perhaps contrary to what we had originally expected when the pandemic broke and we were asked to stay at home and so on, that the group that would be most badly hit in terms of their mental health, that we feared for the elderly, really, both because of the vulnerability that they had for the consequences of COVID 19, but also the vulnerability they had for loneliness and social isolation. It turns out that in every single context in which the burden of mental health problems has been studied in the last 18 months, it's young people who have been hardest hit. And of course, this means that even though the pandemic itself in many countries has subsided, it's not subsided everywhere, by the way. In sub Saharan Africa, for example, in many countries, it's still very bad. But even in the countries where it has subsided, the imperative really for society is to interrogate how we can return life to normal for young people. Because I believe what the evidence suggests is the poor mental health metrics that we're seeing in young people is largely driven by the curtailment of opportunities and personal engagement that is so very important to the well-being of young people.
You know, I heard this very disturbing statistic that suicide is now the second leading cause of death in girls between ages 12 and 18. Is that so? I mean, why is this issue growing in
So
particular the segment? Yeah.
So sorry to interrupt, but so first of all, just to say, suicide's been the leading cause of death, either first or second in young people for the last 20 years. It's nothing new. The fact that most societies have failed to respond to that, it's a shocking statistic, to be quite honest. Not only are suicide rates high in almost every society for young people, but in some societies where suicide data are produced in a reliable way, like the US, for example, or England, Australia, suicide rates have been showing an uptick in the last 10 years, and this is before the pandemic, as much as 30 to 40% increase in mortality rates in adolescents for suicide. So this is a matter of great concern for every parent. It's a great matter of great concern for society. Now, it has to be said that to understand suicide in young people, one has to also understand the broader determinants of mental health in young people, because suicide ultimately, of course, is a indicator of very poor mental health. And I think one important fact that we've also known for a long time now, but not done much about it, is the fact that most mental health problems begin before the age of 24. Indeed, most mental health problems begin within a very narrow period of our life course between puberty and the age of 24. And so we have to ask questions about why this phase of life is such a critical one to understand the onset of mental health problems.
And, you know, of course, stigma doesn't help, and access, and or I should say, lack of access to healthcare doesn't help, which is further exacerbated by especially parts of the world where stigma is very acute. Isn't that so?
Absolutely. But, let's be honest, stigma is not just manufactured in thin air. Stigma is also often the result of histories of how mental health care has been perceived and delivered in many parts of the world. If one considers that mental health care historically has always involved rather unpleasant practices, for example, coercive treatments, being incarcerated in mental asylums, being sedated with medications that often knock you out. If you consider that reality of mental health care, it isn't surprising that people are reluctant to actually seek mental health care. So it isn't just a supply side problem, which is a big one, that we don't have quality mental health care available, but also the nature of that mental health care has to be interrogated. Currently in most parts of the world, by the way, including in many wealthy countries, mental health care is really delivered in a very narrow biomedical paradigm that privileges certain kinds of professionals and certain kinds of interventions. And I think, twin to that, I think we need to acknowledge for young people, and this is particular for young people, there is a very well recognized resistance to seek help from professionals. And this is not just to do with mental health. I mean, you and I can remember when we were young, there's this kind of characteristic feeling of invincibility, and also that I'm not going to go to another adult figure. I'm now becoming an adult myself. The last thing I'm going to do is to go to another adult power figure who is a physician for my health problems. I'm going to try and deal with this myself. So there is that demand side issue that is, I think, perhaps more unique to adolescence than perhaps any other stage in the life course.
Yeah, I mean, can you speak to, areas of hope? What kinds of evidence-based programs are giving us reason to hope that we can actually solve for these problems?
Well, there's a lot of good science that gives us hope, and I think that is something we need to embrace, and we need to now scale up. And in a nutshell, that science demonstrates how no matter what resources a community has, it always has the right resources to help people recover from mental health problems. And by that I mean the human resources that you need to deliver evidence based interventions. We have, of course, the science of evidence based interventions. Let's start with that. Both psychological treatments as well as drug treatments, when used judiciously for the correct kind of mental health problem. But we now also have evidence that those interventions can be delivered by people who do not necessarily have, psychiatric training or who are psychologists. For example, all my work has involved community health workers, lay counselors, peer support workers. Many other parts of the world, people will deploy other kinds of individuals, such as, for example, nurses, nurse practitioners, and so on. So depending on the context you're in, the kind of frontline worker that you might deploy for mental health care may vary. But I think what's common across all these contexts is you do not need many, many years of psychiatric training in order to deliver mental health care well. And actually, doing so can be seen as the frontline foundation of a mental health care system.
Yes. So, this series is called Eureka Moments. And one of the things that can feel like a Eureka moment for someone suffering from mental illness is actually hope. Was there something, or is there something you would say to someone who is suffering right now, who's looking at a reason for hope?
Yes, absolutely. The most important reason for hope is the majority of people will recover, that you need to try things. First of all, try things that you can do yourself. There are many, many practical ways in which a person who's having emotional difficulties or mental health difficulties can actually, address those. Reach out to other people around you, because the simple act of sharing your distress with others who are likely to listen to you in a sympathetic way can itself ease the burden. These days, it is very possible to seek mental health care from professionals without even leaving your home if you have access to an internet device. One of the positive things that's come out of the pandemic has been the complete explosion in services being delivered on telemedicine platforms. And in some ways, the traditional barrier of not being able to have a provider near you has been almost completely obliterated by telemedicine. And in those places where if you're fortunate enough to live in a place where there are community-based mental health teams, that would also mean you can get a provider in person without having to have an access barrier about distance, for example, or cost.
That is, actually, that is really a good point because, the access, I mean, in-person access that has been eliminated by the availability of telemedicine and technology. Were there any other eureka moments for you overall in the last 18 months that have helped you crystallize the issues and found potential ways to actually bring about positive change? Any specific stories or examples of things you've seen work?
Well, I think there's so many, but I'll tell you, I'll pick one, which I think is an important eureka moment. Many, many years ago, 25 years ago, in fact, when I first moved from London to Zimbabwe, I had been very heavily influenced by my anthropology studies, and I really strongly believe that the experiences of mental health were so deeply influenced by culture, so foundationally influenced by culture, that you couldn't actually take any knowledge that had been generated in one cultural context and applied it to another, especially when it came to psychological treatments. 25 years later, having worked in a number of different settings, and of course also studying the work of my colleagues and collaborators in many other parts of the world, the eureka moment I would like to share with you is this: psychological pain is like physical pain, it's a universal human experience. If you slap me, the pain that I feel physically is just the same as the pain I will feel psychologically when compared with a person being slapped in a completely different cultural context. Culture does matter. I am not dismissing that at all. In fact, culture matters for all healthcare interactions, not just for mental health. But at its heart, the way that psychological difficulties are created, the risk factors, the protective factors, the experiences of mental health problems, and the responses to mental health interventions, I have yet to see any evidence that there are fundamental differences between peoples in different cultures. And this is a eureka moment, because for so long the field was stunted by fears and anxieties that actually the science, for example, of psychology, that largely owes its origins to Western countries, particularly the US, and yeah, the US is a major contributor to this field, wouldn't travel to Africa, Latin America, and Asia. The eureka moment is it does. It needs to be adapted like everything does when you go from one context to the other, but the basic science is the same.
That is such a great, great eureka moment, because at the end of the day, what you're saying is that psychological pain is universal and to some degree culture agnostic, so that if there is a treatment or some sort of intervention that is created, that it can actually traverse across cultures and across continents.
That's right. That's right. It also means that we don't have to be constantly asking the question, will it work somewhere else? The question should be, how can we make it work somewhere else? And I think it offers an opportunity to leapfrog into action in places where often there is very little research taking place.
Excellent. You have given us a lot of reason to hope, Dr. Vikram Patel. Thank you for joining us.
Thank you very much.
Thank you, Vikram. That was great insight, and thanks for sharing these stories with us. According to the World Health Organization, 5% of adults worldwide suffer from depression. It's a disease that does not discriminate, and it touches people of all ages, races, locations, and socioeconomic status. Up next is a story about a mental health advocate in Rwanda and her efforts to bring better mental health care to her community.
Every time I had a panic disorder when I was young, they would say I'm possessed, right, by demons, and they would try to pray those demons out of me. If we could get a public source of information to constantly put out trusted information backed by scientists, saying this is what mental health challenge looks like, this is how to deal with the people within our communities, I think that would change the outcomes of a lot of people like me, and it would, I think, drive people to seek care more. As time has gone on, it's become glaringly clear that young people need action on mental health due to the state of the world. We have climate change, we have the pandemic that is ravaging the world. We also have a decrease actually in services for young people. So I think it's even more urgent now to focus on creating lasting change in mental health policy, in mental health service delivery, and in mental health research, specifically for young people across the world. Having a dedicated specialist would have done a world of difference for me. Every leader has been calling out for special care, for special access. They have to put money where their mouths are, and they have to add it to the global agenda. Governments across the world have to add specialized mental health care, specialized mental health information and services to their budgets. My call to action would be involve people with lived experience. We provide a great wealth of information and expertise, and I'm pretty sure, we're willing to be part of the movement.
Thank you, Grace, for sharing your story. Your work is inspiring, and it gives me great hope that we can continue to break down the stigma surrounding mental health and raise awareness and provide broader access to mental health care in the future. One person who has worked his entire life addressing these issues is Husseini Manji. He's a global head of Johnson & Johnson's Science for Minds initiative. He's one of the leading mental health experts and has developed breakthrough treatments for mental health disorders, including for major depressive disorder. I recently sat down with Husseini to talk about the impact of mental health on today's youth and what needs to be done to better address the issue of this particular segment of the population. Welcome, Dr. Husseini Manji.
Thank you, Seema.
So, Husseini, there have been tremendous advances in our understanding of mental health disorders, but we are seeing the societal impact of these diseases continue to grow. So, how have you seen these issues exacerbate over the last 18 months as a result of COVID?
Yeah, Seema, I think that's a very good point. Unfortunately, our societies have been under a lot of stress, certainly with the pandemic itself and the ramifications, including unemployment, social isolation, the fear of COVID, and then in many societies we've also had, racism, etc. And the brain's basically a very adaptive organ, if you will. So under normal situations, when we're faced with the stress, we sort of turn on our system that allows us to deal with stress. Unfortunately, in this case, when it's so chronic and sustained, it really has a lot of hyperarousal of the brain and the body. And so what we're seeing is a lot more mental ill health. That includes depression, that includes anxiety. We're seeing much more of the physical ramifications that mental ill health sometimes causes. And that certainly includes everything from insomnia to headaches, to worsening cardiovascular disease, type 2 diabetes, etc. So it's a real problem we need to come together to try and address.
Husseini, mental illness and mental health issues are profoundly impacting our youth worldwide, and kids especially have been affected by COVID. So, in terms of solutions, what do you recommend for parents, for friends, for siblings? What should they be on the lookout for?
Yeah, so I think the first thing, sure, I think the most important thing is to be on the lookout. So, people will often sort of joke, and it's no laughing matter, but, how do you distinguish from normal adolescence and, sort of a mental health condition? And I think the truth is it is sometimes difficult to really understand, when is this sort of a normal phase of development, and when does it need some sort of attention? And I think three things to roughly think about. It's when something is out of context, it's the intensity, or it's the duration. So say someone who normally was outgoing now has become very withdrawn. That's a change in the normal level of functioning. So if you start to see that, approach them, to try and find out. Same thing about intensity. We're all feeling the impact of the pandemic, but if the person is now not willing to get out of bed, really wants to have no contact with friends or family, I think that would suggest you want to sort of check and see, is this a normal, adaptation to the situation, or has it gotten out of control? The third thing would be duration, is that, when we're all faced with this pandemic and we were trying to adjust to this new way, all of us had this period where we're adapting. If it's gone on for months and months and kids are expressing complete hopelessness and helplessness and are overly focusing on, negative news stories, whether it might be about COVID or climate change or crime, all those are justifiable concerns, but you don't want them to get into a downward spiral. So I think opening up to them, letting them know it's okay to share these concerns, try and get a sense of, is this something that you can either sort of help them with your own support, or if there's any question, then seek professional help. And that doesn't mean going on medications. It could be counseling, it could be peer support, it could be medication, but try and make that judgment as to, when is it just a cold, or when is it a flu that might require slightly more professional help.
But Husseini, what you're also saying is that once you determine that you need help, that there are solutions available,
Absolutely.
right?
I think that's one of the most important things to keep in mind, is that there are many, many solutions. So, and I'd say I'd view it almost like any sort of medical condition. So if you're thinking like, you've got slightly elevated blood pressure, diet and exercise and stress reduction might be enough. On the other hand, if it's more than that, then you might need some medication to lower the blood pressure, plus the diet and exercise, etc. In this case, it's the same, sort of allowing the opportunity to talk about one's concerns, to get counseling. It could be, as I said, in some could be a group format with other young people. It could be something we call cognitive behavioral therapy that sort of helps prevent this downward spiral, or it could be medication. I think there's been nothing good about the pandemic, but one of the things it has done is made digital delivery of therapy much more available. So certainly with telemedicine or software-based cognitive behavioral therapy, we've seen a great adoption of that. And it's interesting that young people actually, many have even told me that they actually prefer to interact with, a therapist online than they would in person. So let's take advantage of the fact that, young people actually prefer some of the computerized approaches and get them the help however they're receptive to it.
And of course, that in and of itself feels like a eureka moment, doesn't it?
Yeah, I think, that's one of the things that many of us had thought for a while, that we need to really move to this model where we can think about reaching people through digital means and through telemedicine, et cetera. COVID almost forced it upon us. And we've actually found that it actually works pretty well. So I think you're right. This is a eureka moment where we're actually, we were forced into it, but now we're learning that some of these things actually work. And I think it's fair to say that we'll never go to the old model where you sort of had to come to the clinic for a visit, et cetera, when you can do so much more remotely.
Yeah, and Husseini, let's talk about stigma. I mean, stigma is such a deep issue, and it's a long-standing issue. What kind of eureka moments do we need to actually eliminate stigma?
Yeah, I think that's one of the big problems with mental health. All diseases and disorders are devastating, problematic. Unfortunately, people with mental ill health have this double whammy. They have the condition itself, and on top of them, there's both societal and sometimes what we call self-stigma. So there should be absolutely no reason for stigma or shame. You can no more will your pancreas to secrete more insulin than you can just snap out of depression. And yet sometimes people, and I hate to admit it, but there are certain cultures where that's even more the case, where people feel stigmatized. If you're only strong enough, you ought to be able to deal with this, et cetera. And then people don't seek the treatment they should get. As I said, sometimes there's certain cultures. So in North America, for example, it might be the African American or Hispanic culture, where there is almost this attitude that you got to be strong to take care of your problems. The Indian culture might be one of those other cultures where there's this, again, a double whammy, where there's more stigma. And then there's also a lot of societal pressures, especially on women, to perform at work, perform at home, et cetera. So it's a sad confluence of events. What we've seen in conditions like HIV/AIDS, what we've seen in conditions like cancer, when we've come together as a society and really both directly try to destigmatize things by raising awareness, by engaging arts and artists to, sort of talk about their own conditions, etc. And then I think one of the biggest things that helps with stigma is better treatment. So if you had someone who was ill, then they go on a treatment. For example, we've been able to come up with a treatment for severe depression that works rapidly. When you had someone who was ill, they go on treatment and they're well. It's almost like the light bulb goes on. Aha, it must have been illness. It's not just that the person is weak. So I think that's what we need to do. And I think in our society, there's a lot of admiration, if you will, for performers, athletes, etc. So one of the things we're trying to do is really engage with a lot of the athletes, the musicians, the singers, to help reach people and let them know that there is absolutely no reason for stigma or shame.
Well, thank you, Husseini. And this show is called Eureka Moments. So we also look at the people behind the science, the people behind the lab coats, and what inspires them. So I want to talk to you about what inspired you, what sparked your interest in this field. Was there a eureka moment for you when you thought, wow, this is what I want to pursue in life?
Yeah, no, I think that takes me back a little bit, but I do think absolutely in medical school. So I had always been fascinated by the brain and the mind, but it was actually working with patients with severe depression where I saw the anguish, I saw the pain and suffering, and then I also saw, unfortunately, the stigma that these people were as ill as people with diabetes, heart disease, unfortunately some cancer, etc. And not only were they in tremendous pain, there was also the stigma that we're facing. And that was almost like a eureka moment that, if I could do something about it, if I could, drive my passion for research into coming up with better treatments or helping people with these conditions. I think it was literally in medical school when I saw the pain and suffering that I almost made the decision, this is what I want to do. And I've been very fortunate to work with some great people along the years and, been able to try and make a difference for these devastating conditions.
Thank you, Dr. Husseini. Really appreciate you taking the time and sharing your thoughts. Thanks for joining us.
It's really my pleasure. Thank you for what you're doing.
Mental health is something that often hides in the shadows. But as our guests today have shared, if there is one silver lining to the challenges of the past 2 years, it is that the pandemic has increased access to treatment and allowed us all to connect with resources and stories from around the world. Thank you to all of our guests for sharing their work and their hope for the future. And thank you for joining us today. Next week on Eureka Moments, we'll be speaking with future innovators advancing bold ideas. Don't forget to subscribe and be notified of future shows. See you next week.